Let's see. Okay, we streaming. Let's see here. I ain't got no chat open. There we go. Boom. My chat is open. Test it, test it. 1 2 1 2 1 2 1 2 1 2 1 2. I always said 1 2. We got 2 people watching. We got 3 people watching. I think the notifications are going out. We got 5. Nobody's in my chat room. Got 6. Nobody's in my chat room. 6 people watching. 6. Can we get 7? Can we get 7? Cassandra Fisher. Hey. Cassandra, you have owned. What's up? What's up, Junior? Cassandra has owned a wrench. And if, is that really my kid? I gotta make sure that's my son. Hold up. Yeah, that's him. Okay. Let me get you a mod. What's up, Trina? We got 8. Can we get 10? Can we get 10? Anyway, let's go, man. Cause I want to make this real quick. I ain't got all night. And I wanted to share a little bit with y'all. So, if y'all ready, let's go. I ain't done this in a... Okay, that's my intro, right? Okay, here we go. I'm acting like a rookie, like I don't know what I'm doing, huh? Anyway, let's go.
Now that's Huggie Pacino certified.
Isn't it? Good, this is me. Oh, man. Honest, undeniably great with the gift of intelligence, everlasting, professional account, currency, and numerous options. It is me, Huggie Pacino, and welcome to another live. I don't know why my chat doesn't pop up anymore. I have to go get the link to my own chat room. Not my chat room. I have to get a link to my own URL and bring it to the program. Thingamajig here. Got to disconnect, then reconnect. Like, oh shit, I hit the wrong button. Keep it, not shift, control. Alright, boom, connect. Boom, that's how that works. Alright, so here we go. Now we got my chat room up. Alright, so what's up, Mama Rika? Alright, so look, I want to share something with y'all. I went to therapy today. Clean your water. Alright, see that? Clean your water. Very important. I went to therapy today. And every time I go, it's complicated. It's very complicated, I will say. But I went today. Today was like the most complicated visit I've ever had. And I know every time I go, it's like very eye-opening, very educational. I learned a lot about things that I didn't know previously in my life in general, who I am, what's wrong with me, what's wrong with many people, how people are in denial about many things. Case in point, do you know that it's safe to say majority of America is currently suffering with depression? Every individual walking this earth has suffered with some form of depression. There's many forms. It's not just one typical thing. Like, you don't just get depressed and it's just that simple. There's many types of depression. One of these 7 common types of depression I suffer from, and we zeroed in on that and it was very heartbreaking. And I want to share it with y'all. So let's get right into the screen share here, if we can. All right. 7 common types of depression. All right. Let me see if I can zoom this in. We should be able to see it, but just in case, let's make sure we zoom it in a little bit. It's about right there. That should be good. But you know, the way I share my screen, we on 720p. When people think of depression, they often divide it into one or two things. Either clinical depression, which requires treatment, or regular depression that pretty much anyone can go through. As a condition, depression can be a difficult concept to grasp since we refer to it as both the symptom of a condition and a condition itself. From a medical standpoint, depression is defined as a mood disorder that causes a persistent feeling of depressed mood of sadness and often profound loss of interest in things that usually bring you pleasure. Depression affects how you feel, think, behave, and can interfere with your ability to function and carry on with daily life. There are many different causes of depression, some of which we don't fully understand. 7 of the more common types of depression, including the following. Okay, you have a list here: major depression disorder, persistent depression disorder, bipolar depression, postpartum depression, premenstrual dysphoric disorder, seasonal affective disorder, and atypical depression. All right. Number 1, major depressive disorder. When people use this term clinical depression, they are generally referring to major depressive disorder. Major depressive disorder is a mood disorder characterized by a number of key features: depressed mood, lack of interest in activities normally enjoyed, change in weight, change in sleep, fatigue, feeling of worthlessness and guilt, difficulty concentrating, thoughts of death and suicide. If a person experiences the majority of these symptoms for longer than a 2-week period, they will often be diagnosed with MDD. All right. Number 2, persistent depressive disorder. Dysthymia, now known as persistent depressive disorder, refers to a type of chronic depression present for more days than not for at least 2 years. It can be mild, moderate, and severe. People might experience brief periods of not feeling depressed, but this relief of symptoms lasts for 2 months or less, while the symptoms are not as severe as major depressive disorder. They are pervasive and long-lasting. PDD symptoms include feelings of sadness, loss of interest and pleasure, anger and irritability, feelings of guilt, low self-esteem, difficulty falling or staying asleep, sleeping too much, feelings of hopelessness, fatigue and lack of energy, changes in appetite, trouble concentrating. Turn this ring off right quick. Give me 1 second. Boom. Not that volume. Turn my volume up. Sorry about that. Treatment for persistent depressive disorder often involves the use of medications and psychotherapy. According to the National Institute, I want y'all to pay attention to this interesting statistic, okay? What up, dope boy? According to the National Institute of Mental Health, 1.5% of adults in the United States had persistent depressive disorder in the past year. The disorder affects women 1.9% more than men, which is 1%, and researchers estimate that around 1.3% of all U.S. adults will have the disorder at some point during their lives. This is persistent depressive disorder. Let's continue to number 3, bipolar disorder. Bipolar disorder is a mood disorder characterized by periods of abnormal elevated mood known as mania. These periods can be mild hypomania, or they can be so extreme as to cause marked impairment with the person's life, required hospitalization, or affect the person's sense of reality. The vast majority of those with bipolar disorder also have episodes of major depression. In addition to depressed mood and markedly diminished interest in activities, people with depression often have a range of physical and emotional symptoms which may include fatigue and insomnia, lethargy, unexplained aches, pains, and psychomotor agitation, hopelessness, loss of self-esteem, irritability, and anxiety, indecision, and disorganization. The risk of suicide in bipolar illness is about 15 times greater than the general population. Psychosis, including hallucinations and delusions, can also occur in more extreme cases. I'm going to repeat that. The risk of suicide in bipolar illness is about 15 times greater than in the general population. You get that? What about it? Psychosis, including hallucinations and delusions, can also occur in more extreme cases. Do you know that there's somebody you, or maybe you yourself, suffer from that? But we know somebody who does if we don't, ourselves, who are bipolar and have never been diagnosed and refuse to even accept the fact that they are. I have a sister that's bipolar. I grew up with her my whole life. I didn't understand it until I got older. Now that I'm an adult, I could be like, yeah, now I know what that is. It's not to be laughed at. It's not to be to poke fun at it. Most people don't feel like they need to get some help. They're ashamed to get help. You know what I'm saying? It's okay. You feel me? Everybody goes through depression. Like I said, these are 7 types. But let's continue. Postpartum depression. Pregnancy can bring about significant hormonal shifts that can often affect a woman's mood. Depression can have its onset during pregnancy or following the birth of a child, currently classified as depression with peripartum onset, and postpartum depression is more than that, just the baby blues. Mood changes, anxiety, irritability, and other symptoms are not uncommon after giving birth. Often last up to 2 weeks. PD symptoms are more severe and longer lasting. I want that to be clear. More severe and longer lasting. Alright? Such symptoms include low mood, feelings of sadness, severe mood swings, social withdrawal, trouble bonding with your baby. I repeat, trouble bonding with your baby. Appetite changes, feeling helpless and hopeless, loss of interest in things you used to enjoy, feeling inadequate or worthless, anxiety and panic attacks, thoughts of hurting yourself or your baby. Thoughts of hurting yourself or your baby. Thoughts of suicide. PPD can range from a persistent lethargy and sadness that requires medical treatment all the way up to postpartum psychosis, a condition in which the mood episode is accompanied by confusion, hallucinations, or delusions. If left untreated, catch this, the condition can last up to a year. Fortunately, research has found that treatments such as antidepressants, counseling, and hormone therapy can be effective. Alright? Number 5, premenstrual dysphoric disorder. Among the most common symptoms of premenstrual syndrome, PMS, are irritability, fatigue, anxiety, moodiness, bloating, increased appetite, food craving, aches, and breast tenderness. Premenstrual dysphoric disorder produces similar symptoms, but those related to the mood are more pronounced. PMDD symptoms may include extreme fatigue, feeling sad, hopeless, or self-critical, severe feelings of stress or anxiety, mood swings, often with bouts of crying, irritability, inability to concentrate, food cravings, or binge. All right. Number 6. This is the one that was kind of like when we touched on this at therapy. If you experience, seasonal affective disorder. If you experience depression, sleepiness, and weight gain during the winter months, but feel perfect fine in the spring, you may have a condition known as seasonal affective disorder, which is called SAD, S-A-D, currently called a major depressive disorder with seasonal patterns. Alright? SAD is believed to be triggered by a disturbance in the normal circadian rhythm of the body. Light entering through the eyes influences this rhythm, and any seasonal variation in night and day pattern can cause a disruption leading to depression. Alright? Light entering through the eyes influences this rhythm. You know what I'm saying? Like, and I did my research on circadian, like, which is this is some real deep shit that most people don't research. You feel me? Prevalent rates of SAD can be difficult to pinpoint because the condition often goes undiagnosed. Keyword. Which a lot of us are walking around and they probably like, oh my god, I don't have any problems, I'm perfectly fine. And no. A person that has to say to themselves they're fine, they're not fine. They're not okay. It's only when you look in the mirror, and it's only when you like get to yourself in that room that no, you're not okay. Like, we've all had this feeling of depression or sadness. Like, we've all lost somebody we love. We all gotten heartbroken by something we lost, whether we've been unemployed or whether we've been homeless or things of that nature. Even the people that are rich, your entertainers, are the most depressed people of all. The richest people, billionaires, millionaires, you know, that they get depressed too. Trust me. Like, we ain't never heard of a millionaire that committed suicide. Look at Robin Williams. Matter of fact, let me show you Robin Williams. Hold on. Look at Robin Williams, right? You rarely see this guy unhappy. Like, far as never seeing him without a smile or a silly face. Let me find the perfect picture. Recent picture before he died. This is a recent picture. Alright, here we go. Robin Williams. Suicide. Hung himself. He asked himself, like, well, wait a minute, what Robin Williams? Yeah, because a lot of people smile and they tell you they're happy, they're okay, and they could be funny, they could be the great people, most excellent people you've ever met, and they get along. You never know what they're going through. You never know what they're going through. Even the people that's, well, quote unquote, around this community, trust me, you never know what they're going through. Anyway, prevalent rates of SAD. SAD can be difficult to pinpoint because of the condition often goes undiagnosed and unreported. It is more common in areas further from the equator. For example, estimates suggest that SAD impacts 1% of the population of Florida. That number increases to 9% in Alaska. SAD is more common in far northern than far southern regions of the planet. Can also be treated with light therapy to offset the seasonal loss of daylight. And number 7, atypical depression. Do you experience the signs? Let me make sure I move this down. Do you experience signs of depression such as overeating, sleeping too much, or extreme sensitivity to rejection, but find yourself suddenly perking up in the face of a positive event. Based on these symptoms, you may be diagnosed with atypical depression. Current terminology refers to this as depressive disorder with atypical features. A type of depression that doesn't follow what was thought to be the typical presentation of disorder. Atypical depression is characterized by a specific set of symptoms related to excessive eating or weight gain, excessive sleep, fatigue, weakness, and feeling weighted down. Intense sensitivity to rejection, strongly reactive moods. Atypical depression is actually more common than the name might imply. Unlike other forms of depression, people with atypical depression may respond better to the type of antidepressants known as monoamine oxidase inhibitor, right? Now, that last one is what I suffer from. I have been in denial about what I learned. Well, not today, but yesterday, because today is Saturday. It's not Friday anymore. Still Friday on the West Coast. What's up, West Coast? I was watching, but yeah, um, I've been in denial about that, and I learned about it today. And my son, if he's here, I go back and look at the picture when I held him as a baby. What up, princess? What up? I ain't nobody else in here. I thought that was somebody else. That's Alan. What up, Lala? I look at the old picture of my son being in my arms as an infant. I was 6 feet 235. It's a little stocky. And I noticed that a lot of that depression has set in over the years. Many years just go by, and I think about a lot. I think about a whole lot about being in denial. Most of us aren't in denial. We try to be publicly in denial about what's wrong with us. Nobody's perfect. Nobody has the perfect life. I don't care who you are. I don't care where you're from. I don't care what you got. I don't care what you want to pretend to be. I don't care if you got a Mercedes, a Lexus, a yacht. Today was the worst day of my life at therapy because I actually sat here and I tend to think that maybe, just maybe, I could have some form of, how can I put it, some form of mental freedom to just be consistently happy. I learned that I've been caring more about people than I care about myself. I've been loving others more than I've been loving myself. You know, You know how weird that sound? Something as possible as it may seem. What up, Nolans? What's good? And I learned that when you put others before yourself, you have nothing to show for it. It's the most damaging thing that you can experience because you feel, well, I just want to express my happiness so much that I'm just too busy trying to give it to everybody. Family, friends, relatives, whatever. And then you start thinking, damn, I ain't got nothing to show for it but myself, all alone. You start having regrets. You start thinking about, like, damn, what, like, damn, I get stabbed in the back. I get crossed out. I get dogged out. I get mistreated. I get used and abused and etc. Verbally, physically, you know what I'm saying? But my dad was like, man, that's just the way you are, man. But he was like, man, you gotta change. You gotta change that mindset. We gotta change that mindset, cause it'll slowly kill you. It'll break you down. And I get, I never could understand how I would be depressed and I don't get to the point where I want to just starve myself. And I tend to just don't think about not eating. I tend to get hungry. Like, my issue is that I would eat late because I did security, so at least half of this time I've been doing this profession, I'll be up all night, 2, 3, 4, 5 in the morning, and I have a habit of my appetite grows. And I don't. It's not like I'm gonna be like, well, my appetite is growing. Let me go get something healthy. I don't give a damn what it may be. I would be more conscious about something that I don't feel comfortable eating. Like, I'm not gonna eat pork because I don't want to eat pork. I don't like it, if that makes sense. But I would eat other stuff that I shouldn't be eating. So the complicated thing about trying to eat right is that depression doesn't help it. It doesn't. At least the atypical depression that I figured out that I suffer from, it's complicated. It's very complicated, you know. And I can look and say to myself and say, I want to fight this, but it's complicated fighting it when you're mentally and physically alone. I think I've told this before. I've had so many animals because that was my sense. That was my sense of sanity to keep me from being depressed. It was a stress reliever. I still got my boy Julio right now. And I'm not gonna lie to you. He heard me call his name. Y'all hear that? What up, Jan? What's good? Um, my dog is 7. He's not gonna live forever. And I'm not even gonna lie to you. I worry about he's not gonna live forever. What would I do? What would I think? How would I feel if he wasn't here? I ain't gonna lie. He keeps me together. You know, I try not to. I try not to open up to new people. I'm not as friendly as I used to be. You know, I got this shield up where I'm not really comfortable. I'm not as social as I used to be. I'm very protective. Very. Relationships. I'm just protective as hell now. I told my dad, I said, maybe I'm paranoid. He's like, nah, you ain't paranoid. You just aware. Energy vampires is everywhere. One thing about energy vampires, they don't even know they're being vampires until they strike. But trust me, every energy vampire is not malicious. They don't have the intent. They don't realize what they are until they look themselves in the mirror and realize, yo, you're saying something to hurt someone's feelings. You're hurting someone's feelings. You're not being the person you need to be. The most selfish individual will say they're not responsible for making you happy. Especially when you tell them, you don't make me happy. You make me upset. You influence my anger. Lack of accountability. I don't know why that's not a form of depression, but it should be. Trust me, I want to hold myself accountable. If I make you upset, I want to make sure I don't do anything to make you upset. But remember, there's always cause and then effect. There's no such thing as an effect and then a cause. It's not how this works in life. And I'm so sick of people I meet in my life where they always want to talk about the effect and not the cause. Today was really hard for me. Very. I talked about things that I refuse to talk about on YouTube because this ain't for everybody. Some of y'all wouldn't understand any of it anyway. I went back to middle school. I went back to high school. I went back 10 years ago. I went back 5 years ago. Something happened to me. Matter of fact, like why not share this with y'all? Like why not, right? So and I'm gonna go because this already been how long? How long we been live? 30 minutes. 30 minutes too long. Don't go nowhere, Jen. Stay right there. So November the 7th. No. Let me go back. November the 6th. I wake up. Let me get it right. I want to get the dates right. Give me a second. Nah, it wasn't the 7th. It was the 3rd. November the 3rd. November the 3rd. No, was it the 3rd? Hell yeah, it was the 3rd. November the 3rd. Okay. I wake up at 11 o'clock and I had to be at work at 12. So I woke up at 11 o'clock, had me a bowl of oatmeal, and I had me some tea. The oatmeal I was eating has dates and I want to say walnuts was in it. Walnuts and dates. Dates and walnuts, I believe. I had tea. I had warm water. I had lemon in both. That's how I started my morning. I went to work. I noticed that my stomach had this kind of an achy type feeling, but it was okay. And then as 12 o'clock, 2 o'clock, And I want to say around about 2 o'clock is when I felt like this oatmeal was just sitting on my stomach, like it wasn't moving. And then this sharp pain was like hitting me, and it felt like, I don't know what it's like to feel like being stabbed, but it felt like I was stabbed in my stomach. It was the worst pain, but it kept like coming and going, coming and going, and like come and go, come and go. And this troll account, I'm gonna need this troll account to be blocked. I'm not allowing these type of trolls in my room. This ain't that type of channel. I appreciate you coming through saying what's up, but I'm gonna need you to fix that. You wanna come in here, come in as yourself. Don't come in with the troll account, please. Thank you. So anyway, my stomach had this pain that I couldn't get like past, and I want to say I took a downtime at 4 o'clock. Between 4 and 6:30, I take a break. But my break consists of going to my truck, going to sleep. I was exhausted all of a sudden, and this pain was like coming and going. I wake up, go sleep, wake up, go sleep, and I couldn't get it. I was like, what the hell is wrong with me? So I got up around 6 o'clock. I finally had a bowel movement of that oatmeal. Much too long of a day to go by with that. And keep in mind, I had been drinking water that whole day, but it just seemed like the more I drank water, it felt painful. So I try not to drink as much. I go get a bottle of laxative. I'm thinking like, well, maybe I'm having this problem with my, constipation or something, whatever, right? I go take a bottle of laxative. That only made it worse. It just seemed like it just got worse when I did that. And goodness, nothing happened. No bowel movement. I knew then something was really wrong with me. Cause, well, my insides is good. Ain't nothing to run through me. I tried to make it through the day. I did. I got off at 10 o'clock. I went directly home. I didn't even get out of my clothes. I get out of my shoes. I slept in my work shirt, my pants, and I went directly to sleep. I had to be at work at 9 o'clock in the morning, so all I was thinking, like, if I could just go to sleep, I'd be alright. I woke up at 4 in the morning, and that pain in my stomach felt like I was being stabbed, and it felt like the knife was like turning. And I remember yelling very loud when I woke up, holding my stomach like shit. So I called in, of course. I'm like, man, I'm not gonna make it to work. It's not gonna work. I'm not gonna make it. I did the same shit. I got up and got some oatmeal, got me some tea. I figured, well, let me go about the day. Let me just take a day off. Then maybe I could just sleep. We'll work through it. It'll run its course. Well, 4:30 got worse. Again, that pain that I felt when I woke up hit me at 4:30, and I said, no, can't do this shit. Instead of going to urgent care or something like that, I ended up going to the ER. What I'm mistaken. So I go to the ER, and I got a what did they do? I know they did a ultrasound. They did that second. The first thing they did was they did a CAT scan, right? CAT scan first, and they did an ultrasound. And when they were doing the ultrasound, of course they got to put pressure on your stomach. So, and for some reason, I was thinking like, please don't be my liver, please don't be cancer, some crazy shit like that. Cause I was like, whatever it was, it had to be something bad. Had to be something very bad, cause it was too painful. And doctor comes into the room, was like, your gallbladder is infected. We have to prep you for emergency surgery tomorrow. And the doctor didn't tell me that way. he was like very nonchalant and weird. He was like, he just said it and he was like jittery and just said it and just walked away. And the other doctor was in the room like, and I looked at him like, what did he just say? He was like, man, that's just how he is, man. Um, he was like, this is how he is, man. I'm like, was he serious? Like, what do you mean? Like, cause I'm like, I ain't never heard of like, well, back chat, Fred. I ain't never heard of no, like gallbladder. Like, what the hell I'm gonna do? Like, if I, like, am I gonna like, is this gonna be okay if I? And he tried to explain it to me better than he did. He said, look, man, just you have your gallbladder removed. You're gonna have to change certain ways you do stuff or whatever. But other than that, he was like, you'll be okay. And so you know, I sat there the whole night. I didn't sleep till like probably what 2 in the morning. Yeah, I sat in there and I was like, damn, I ain't never had surgery before. Like, what the fuck I'm gonna do? Like, I don't know what it's like to be cut open. I ain't never been cut open. You know what I'm saying? Oh, so you know, they explain like the two ways they can do the surgery. They can have this little thing where they explain like what could be done and how they do it. Like, and I didn't get this information till the morning, so it's like I gotta wait. Like, what the fuck? Like, oh, so in the morning I get this information about what they're gonna do. You know, which ways they can do it. They will only do it this way if they have to. Like, other than that, they have a small incision above your belly button, right? And to the right side of my stomach, they have like 3 holes. The holes are where they could be able to look inside the stomach and be able to clip the gallbladder from a certain angle, sew it up or whatever, and then they pull it through the belly button. It's a safe way to do it, and it keeps you from going through the process of having any type of pain, and you can heal a lot faster and go home same day or the next day, right? Can't go back to work. You have to wait, you know, of course. But anyway, so, well, I go through the surgery process, right? And I remember going under anesthesia, and I was out. So that's all I remember, of course. Well, keep in mind, I went in there with a stomach ache, so I didn't have a cold, none of that shit. I go to sleep, I wake up. All I remember, and one thing, for some reason, I remember, vividly remembering, going, I remember that, but my eyes weren't open. I do remember taking a very deep breath, like, and I remember doing that. But my eyes was closed and I don't remember where I was. I remember doing that, and the next thing I know, I wake up, all of this, like all the way down here, was like very irritating. It was very painful. All this was like itchy, and it felt like dirt, and it was like, ugh, it was like and I couldn't talk. I'm in the hospital like, can't say shit. I'm in there literally like, and I'm like reaching like water. I'm like reaching for shit because I can't talk. And they like, can you write it down? So I get a pen and paper. I'm like, and for some reason, coughing up blood. I'm coughing up fluid. And I've had pneumonia before, and I'm thinking to myself, how the fuck am I coughing up fluid? Like, what did they do to me? So now I'm like, what is going on? So, to make a long story short with this shit I'm explaining right here, of course they had to put fluid on my lung, put you to sleep, you know, and all this other shit. They left too much fluid on my lung, and it developed pneumonia. So they basically fixed the problem, gave me surgery, and created another problem that I didn't have when I came here. Instead of them really zeroing in on the fact that they gave me pneumonia, left too much fluid on my lung, they're constantly giving me bullshit like, why would you give me juice? Why would you give me sweets? Why would you give me jello? Like, of course I got a liquid diet and all this other shit, but why would you give me this shit? Like, I know what's wrong. Well, we don't think you have pneumonia. We want to get you another test. We're going to do this. We're going to do that. We're going to do another CT scan, blah, 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 blah. Right? My oxygen level is low, my blood pressure's up, and my heart rate is like a motherfucker. When you have pneumonia, your heart rate is going to be high, your blood pressure is going to be up, and your oxygen level is going to be low. That's how it works. When you have an infection in the lung, those three things are going to happen. It might not be as extreme, but it's going to happen. But instead of them they're not even willing to admit, yo, we left too much fluid in your lung. We're going to zero in, we're going to give you some Levaquin, we're going to give you some antibiotics. They was like, Mucinex. I'm like, bro, I'm not taking no Mucinex. Well, you got to be able to take this to get better. I said, bro, I know what's wrong with me. Why y'all giving me Mucinex? Y'all already gave me Jello. You already gave me juice. You gave me cranberry juice because, of course, I got to eat. So, of course, surgery was over at like afternoon. I didn't come to till like maybe 3, 4 o'clock or some shit. I'm like grabbing my phone, like, let me call my pops and shit. Like, who do I talk to? And or whatever. So later on that evening, around about, I want to say 9 o'clock, the lady's coming to do a breathing treatment. I'm thinking like, a breathing treatment for what? Like, so I was thinking like, so they going the right route to fix the problem, but they gotta run tests. So you don't even want to say, yo, we fucked up, we got too much fluid in your lung, we gonna fix this though. Instead, they just trying to beat around the bush like, let's take care of the problem lightly, but give him bullshit. Like, come on, dog. But anyway, so I get to this nurse doing my breathing treatment. They got me on oxygen. It's under my nose. They got me on, like, I think the number was 4. They got me on 4 oxygen. So that means like it's forcing me to have a O2 level of 96 with the thing in my nose, right? When they take this thing off, they gotta give you a breathing treatment with the oxygen off. So of course with the breathing treatment, now I'm getting a natural oxygen level. So of course they got the thing on there, they checking my oxygen level, and she's seeing that the oxygen level was down to like 88, 87, 86. And she said your oxygen level is too low. And they don't want to take a chance on having your oxygen level too low, because if your oxygen level gets too low, it cause, problems with the brain. They tried to come up with all type of shit, like they take me down to ICU because they want to keep a better eye on me, and I'm a high priority because I did just have surgery hours ago. So like, let's take them to ICU, let's just make sure we keep an eye on them, keep them plugged up, make sure we get the proper treatment, because we don't want to just keep them up here and we just do all the necessary things because he just got out of surgery. They put me in ICU because of that, but they also know they fucked up, and they don't even want to admit to, yo, we caused this problem, but we don't want to just. So of course, they take another CT scan, they do an X-ray, they do all this bullshit, and I wake up the next morning ICU. They coming up with all this other shit. They constantly giving me this Mucinex pill. They were doing this stuff where they was giving me the what's that thing? They gave me like the shot that makes you like urinate, and it like flushes your lungs out, or something like that. Whatever it was, it makes you pee a lot. So that kind of helped. And then they gave me Levaquin maybe twice. So they were taking the right steps to fix the problem, which was clearly simple. I got pneumonia. Get this fluid off my lung. Because I'm constantly coughing up blood too. I'm not trying to be graphic, but we're just keeping it real. I'm coughing up blood with the mucus, and I'm not breathing right. I know what's wrong with me. I got an infection on the lung because they fucked up. Along with the fact that they had this tube down my throat, which probably caused some type of fucking internal bleeding in the process of the infection. All of that shit coming together, it just fucked up everything. So eventually, I got better. This was Monday. I checked myself in, and Tuesday I had the surgery. Wednesday is a whole nother day. I'm back on the main floor. Thursday I checked myself out, and I'm gonna tell you, I had my dog at home. My dog ain't seen me in days. He didn't have any food, etc., etc., etc. So this the killer part. I didn't want to stay there no more. Now I didn't check myself out. They let me check they allowed me to discharge, and I was good to go. Right? They gave me 3 medications. I know for a fact The more I walk, my oxygen level is so fucking low because with this phone, I'm able to check my oxygen level. I'm in Kroger trying to get a prescription to the point where I'm on the what's that shit? The little things that you ride on. I'm on one of those, right? So I'm on one of those because I can't walk around. Like I can walk. It's not painful for me to walk, but I know my oxygen level is dropping the more I walk because I'm putting too much pressure on my lungs. So I have to be able to just relax and be able to get on the little scooter thing. So I'm getting my prescription. I'm getting my dog food because my dog gotta eat. And I'm thinking to myself like I'm pacing myself like time and shit. Like yo, I'm gonna get to this scooter in the store. I don't have to walk. So as long as I'm on this scooter, as long as I don't walk, I'll be okay. I get my prescription. Boom. I'm going to the door. I'm going to the door, and I'm thinking like, damn, I parked so far away, right? I was like, shit. I gotta get to the car. And all I kept thinking, the more I'm doing all this moving around, thinking like, damn, I'm gonna drop dead. My oxygen level too low. Like, I swear, literally, I'm gonna show y'all what I was doing, right? Look. I'm in this motherfucker, right? Where is it? Oh, goodness. Here we go. There's a strip. That's not it. Where the oxygen menu at? Here we go. Boom. See that? So if you get one of these smartphones, you hit this little button right here. You see this? And you put your finger on there. We all know how these work, right? Boom. So I'm doing this shit, like walking to my car, like, and I'm looking at the number 92, 91, 90, 89, 88. I get to my car. I'm checking it again, like, start it over, check it again. I'm like, shit. My oxygen level just sit at 88, 87, 88, 89, 90. The more I walk, I'm literally killing myself, not even realizing that. Maybe I should have stayed in the hospital for another day. But all I kept thinking to myself, man, these people gonna kill me in this bitch. They don't even know how to be honest with me. They don't. They did 2 CT scans. They did 3 x-rays. And they did a heart check. Because, man, let these motherfuckers tell it. I got sleep apnea. Of course, I get the test from the heart results like 3-4 days down the road while I'm at home trying to get better. They didn't even tell me that day the results from the heart check. Like, y'all just doing shit, just trying to beat around the bush about fluid you left on my fucking lawn. So, the prescription that they gave me, one was for blood pressure. Like, I'm a big nigga, but I ain't got no blood pressure problems. However, blood pressure, Percocets for the pain, and some other shit that I don't remember what the fuck it was about, but it has something to do with some shit I needed. I forgot what it was. It's somewhere in here. I'm not gonna look for this shit. But anyway, so I said, I need some antibiotics because to kill the infection of the lung, you need amoxicillin, or you need some type of levaquin, or you need some type of ciprofloxacin or whatever. You need something to kill the fucking infection of the lung, right? So I get the shit, boom. I'm knocking this shit out in like a couple of days. I'm getting better on my own. But they didn't prescribe me shit for the fluid on my lung. I stopped coughing up blood because every day I was in there, every day I woke up all through the day coughing up blood, coughing up fluid, coughing up blood, coughing up fluid. They was not telling me what was wrong with me. What up, Sheila? So these people were just really just like, and one thing about it is that I study energy and I'm studying vibes and who these people. I'm like, yo, these people like shit. I had to fuck up out of here. That's all I kept saying. I gotta get up out of here, man. Cause they not telling me now. One time they say, man, we think we got flu. They try to do experiments on me and shit. They got me on this little shit that you have where you got sleep apnea. They put this thing on your face and it's like all this oxygen. So like when you do this shit and like when you inhale, it gives you a whole bunch of fucking oxygen. Like, and I was like, it was cool, but I got it on my face, right? And right here, it's like a seam where like a whole lot of air was coming in, hit me in my eye and shit, and it was very uncomfortable. I fell asleep, woke up with that shit on like within 20 minutes. I was like, yo, bro, I can't do this shit. And the dude was getting upset. He's getting upset because I don't want to wear this fucking mask that's got, doing all this crazy shit, which is, for people with sleep apnea, but I don't got no fucking sleep apnea. The fuck? Because I know what the fuck is wrong with me. I've had this shit before. I know what it feels like to feel like you got a hot brick of a fucking heavy weight, hard ass weight from here all the way down to the bottom of your stomach. Now can y'all imagine? I just had surgery where you pulled my gallbladder and I got fucking pneumonia. What the fuck? Really? But anyway. But long story short, I am better. I could tell by the way I digest my food. All that shit is totally different. The way I eat, totally different. At least I try. But I'm at a point where I gotta be cautious about what I do now because it's totally different now. So what I have realized is that I went through all that shit and I didn't say a word. I just want it to be better for me. Oh yeah, let me tell y'all this. So y'all know I got a radio in my car. It has a detachable face where the screen pops out and it flips up. Of course the screen was not popped up, it was in, face off. Y'all know when I got out the hospital, my radio was gone and somebody done tore my whole dashboard up trying to take it out. Tell me they want a crackhead. You stole a radio with no face on it. I'm talking about crack because if you know if you ever seen the fuck kind of car I got Trailblazer. If you seen a Trailblazer, mine is a '05, right? So it's like they got the dashboard that sticks out with the air conditioner vent at the top. Motherfucker cracked all like it's my whole fucking dash with the fucking 4-wheel drive button and the fucking rear windshield button. All that shit is on the side of the fucking passenger seat. Hey, fuck my shit up to take a radio with no face on it, yo. That's a crackhead move. So imagine I come out the hospital. I'm on this fucking. I'm walking to the car. It's cold as shit. And my radio's gone. What the fuck? And I'm like, cause all I kept thinking was like, I'm finna go to my car. I got my face in my pocket, and I'm finna pop it in there. And as soon as I opened my door and sat down, I said, man, what the fuck? Who steals a radio with no face on it? Who does that? And I was like, man, whatever. So, anyway, but I am better. I will say one thing. I will share with y'all one thing I said in therapy. I'm not afraid of death. I'm afraid of living. And I'm gonna say that what's the point in me trying to go through a process where I can keep living just to suffer, right? I ain't gonna lie to y'all. I sit back and I reflect on, because it was my choice to have surgery. They didn't force me to do anything. I could have gotten a second opinion. I could have went to a specialist. I could have did all the necessary steps that I wanted to do. But there was no guarantee that I live to even make it to the next day. And the way they explained it was like, we don't know how much longer you got, because if your food is not moving and your gallbladder is preventing you from eating anything, and when you do eat something, it could cause internal damages. So the purpose of it was emergency, is what they said. So then I started thinking to myself, and I'm gonna be thoroughly honest with y'all. I sit back and I wonder, what if I went home and I didn't wake up? Because honestly, I really wanted to just go home. Like, fuck it. And not think none of it. That's why it's so bothering. That's why it bothers me a lot that I went through doing what I did, and I'm only here because I choose to be here. Pain ain't nothing but weakness leaving the body. I'm not even gonna lie to you. I was like, I didn't say, please make me feel better. Please, I want to go through it. I was thinking to myself, like, man, I just want to go the fuck home. I just want to go home. So what? Oh, I might not get a chance to have a second opinion. So what is how I felt, honestly. And then the more the more I look at it, man, like, I did this shit, and it's like, damn. Man, I said, damn, they trying to kill me. So what the fuck, like, I'm not suicidal, but goddamn, like, my way of going home and just dealing with the fact that I might not wake up, like, damn, I come here and I get help, and y'all trying to kill me. Yo, shit is crazy. Like, I was like, I had the surgery, and I was like, I just remember going under, and the lady was like, 5, 4, 3. He like, count to 5. 5, 4. Next thing you know, I was out. It's like, I ain't gonna lie, man. It's a couple of things that I've always, like, even when I used to be Muslim, right? It's a couple of things that I can't shake, as far as like feelings or habits or thoughts. Like, death ain't shit to me. And I know people say that all the time, like, yo, it ain't like, yo, like, bro, that death you had last week was crazy, bro. Like, I feel you. It's like, ain't nobody experience. But it's like, shout out to G, because G was like, man, I done died so many times. Like, man, we got to go some kind of way. You know what I mean? And I was like, man, I'm not afraid. I'm fearless with that type of thought. That type of mindset, it don't even bother me no more. It's like, I be thinking like, damn, like, if it's time to go, it's time to go. You know what I mean? This ain't the first time I almost died. I be like, man, how bad can it be? What I am gonna be pissed about, if I am to die, right? Who gonna give a fuck? I'm pretty sure there's people that do care about me, who do love me, but what type of impact am I leaving? What type of message did I leave? What type of effect? No pun intended with the channel, but the effect would I leave behind? Like, I remember talking to my mom when I had pneumonia years ago, and I was like, man, I just want to go home. I want to get out of here. And they was like, if you discharge yourself, we can't be responsible for what happens to you, this, that, and the third. And I was like, man, I don't care what happens. Just let me out of here. I felt the same way when I got out of the hospital. When they discharged me, I had that same feeling, like, I just want to get out of here. I'm literally walking to my car like, yo, I'm not even supposed to be walking around, yo. Y'all gotta know this. The day of Thursday, early the afternoon, evening, I'm walking around the hallway and I'm checking my O2 level and I'm thinking like, man, I'm not even breathing right. So this fluid is still on my lungs. It's not getting any better, and I'm like, I ain't gonna go home today. I ain't gonna lie to y'all. The lady checked my O2 level. I'm doing heavy inhales and exhales, knowing that's not properly the right amount of oxygen I got. The lady checked my oxygen level and it was at 94. That particular check allowed me to go home. Truthfully speaking, my oxygen level probably went more than 90. Can you imagine if I walked around? I was just telling y'all I was at 87, 88, you know? All I kept thinking, oh, I got 94. I'm good. Yeah, I'm gonna see about letting them discharge you. They probably was thinking like, man, let's just get this nigga up out of here. This black nigga, get this black man up out of here. I mean, the more I think about that Thursday, they ain't even do shit but feed me. couple of breathing treatments. They ain't really did no. They did a X-ray. They ain't come check on me. Not one nurse came that whole fucking day. How you doing? How you feeling? Don't give a fuck. Jeremy, what up, bro? Thank you, Alan, man. I'm not. I'm sorry. I'm not really reading like too much of what y'all say, but thank you, Mama Rican, for your words and that chat, Fred. I ain't losing a lot of weight. You could tell like my neck getting a little small. I got a little neck showing. I got a little neck showing. I lost about 15 in the hospital alone. Like, you know what I mean? I will say this though. I hate. Listen, I'm begging these people because I was on the what floor was I on? I was on the second floor. No, I was on that second floor. I was on the fourth floor, I think, fourth or fifth floor. Whatever floor I was on a higher floor before I left and went to the ICU. I had a cute, nice nurse. She was very nice, and she was black. She was natural. She was so fucking nice to me, and I was just so, I was so, I was just so attached to that person. Cause her energy was amazing. She came and checked on me. How you doing? You okay? And she would like grab my hand, like, you doing okay? You fine? You need anything? And I was thinking to myself, man, everybody don't take this profession serious like that, but she did. Man, they put me in ICU and then put me back on the third or fucking floor or some bullshit. I was like, man, what the hell? Bullshit ass nurse. Some little white lady. Fat white lady. No. Nah. I will say this though. I'm gonna get up out of here. I keep saying I'm gonna get out of here. I'm gonna get out of here. I will say this though. I see you got some fine women though. I ain't gonna lie. Those some fine women that I see you. I don't know what the fuck. Jeremy, bro. Listen, Jeremy. Hey, listen to me, bro. Methodist South. I see you. Got the finest women I've ever seen in my life, bro. I've never seen that many good looking women in ICU, bro. In any doctor's office, bro. Beautiful. I was like, what the fuck is this heaven? What the fuck am I? What the fuck am I in? Is this heaven? Yo, I swear to God, bro. I was in this bitch like, yo. It wasn't listen. There was no ugly women in ICU, and it had to be 7 or 8 of them. I was like, what the fuck? Like nobody. It was 2 white girls and 6 black. 2 white girls and 6 black, and all of them at least 30 something plus. All of them. It was old. Listen, old black chick gotta be probably late 40s, bro. Bad. Bro. I was like, and they was like, you going back to the floor, Mr. Hart? I'm like, yeah, I'm going back to the floor. Well, we gonna miss you down here. All right, yo. Jeremy, go take a visit, bro. You're gonna be like, just try to get nosy. Tell me you wanna come see somebody in ICU, or tell me you got the wrong patient name or some shit, bro. And listen, I would give you matter of fact, hit me on the phone. I'll tell you your name, bro. Matter of fact, I'm gonna text you the name right now. Who the phone is? The one I know you like, bro. The one I know you like. Look, me and Jeremy. Hold on, y'all. I'm holler at Jeremy real quick. Hold up. And don't say this out loud in the chat room. I just gave you one name. That's the one. Like, bro. Anyway, I appreciate y'all for coming through, man. I didn't even want to make it this long. I wasn't even gonna get into that, what happened to me and shit. But I figured since I was just cause I'm talking about this in therapy today, and I haven't been in therapy since I been out the hospital. So I find your happiness And if a person does not appreciate you being unhappy, and if a person does not look at themselves and feel like they're the cause of your unhappiness, then maybe you need to let them know. And if you don't want to let them know, you don't have to. Because if they're making you unhappy, they should recognize it. And if they don't want to recognize it, or if they don't recognize it, then they have problems. And I don't mean it in a negative way. I just know that there's people out here who don't give a fuck about making you happy. They don't give a damn about how you feel. You could tell them, I'm blue in the face right now and I can't breathe. They're going to be like, well, all you got to do is just inhale. Try. They don't give a fuck about how you feel. Honestly. But I'm too busy. I'm the considerate person. I'm always caring about how people feel. I'm always looking out for everybody. Hey, Al, you know what's easy work? Black men die from stress at early ages. And don't nobody give a fuck. They don't care. That's enough to let them people know, whoever it is, friend, cousin, relative, parents, whatever, that I refuse, and I refuse to allow people to ruin my mood or add to my already existing depression. Because I'm not going to lie to you. People can add to your depression, or they can heal and help your depression. And if you're not helping my depression, then what are you? Who are you? Do you care that you are not helping it? Because some people out there give a fuck about really making you feel worse than who you really are. They get a kick out of doing everything wrong. They get a kick out of making you feel worse. Remember, depression has no name.
Now that's Huggie Pacino certified.
And that's Huggie Pacino certified. Y'all want to hear all my intros? Let me go through all my intros. Here's the other one. Hold on real quick. Oh shit. I didn't freeze up, did I? I froze up? Okay.
Now that's Huggie Pacino certified.
Okay, that's the fourth. I ain't got but like 4 voices. I need to step my game up. I need some more voices. I need voices. I need voices. Do you hear the voice? Okay, okay, so that's the first one. This is the original one. This is a friend of mine named Angie from like years ago. I need to see how Angie doing. I need to talk to Angie so low. Okay, that's Angie, and this is my ex Ebony. This is hers. So for those that don't know, they're not the same. They're all different, right? So this is that one. This is her.
Now that's Huggie Pacino certified.
You could tell she country as hell, but anyway. Ew. Can't tell you who this is.
Now that's Huggie Pacino certified.
Yeah, 'cause I ain't gonna have nobody harassing her, and this is somebody else I'm not gonna tell you this is.
Now that's Huggie Pacino certified.
Okay, And I got the other intros, and we ain't finna go through all that shit. But anyway, let me play a video. Everybody got boo dirty, man. I gotta play about this.
One teatro, vai! Vámonos! Let's get this money! Come on!
The Doty pussy rap won't let me in. I think it's time I break the choppers out again. Yeah, he ain't gonna ride by himself. He ain't gonna slide by himself. He keep 20 niggas with him. He ain't gonna die by himself.
What you doing, bro? Come on, bro. Get into him.
Yeah, my shit. Out. Don't let her shit like this. That shit go in on it. Out. Don't need no
Out. I've
been knocking at the door, the pussy rapper won't let me in. I think it's time I break them choppers out again. Yeah, he ain't gonna ride by himself. He ain't gonna slide by himself. He keep 20 niggas with him. He ain't gonna die by himself. Nigga, show your gangster crib. You at show with my gang. You should hold in your little chopper. You ain't gonna shoot a damn thing. Bitch, I know your background. You ain't gonna shake nothing but some hands. And I raised them little shooters. They ain't gonna blow nothing but some gas. Go hire you a hitman. You ain't gonna blow nothing but some cash. Swear to God on my mama. When I see you, that's your ass. And I've been chilling out lately. I've been kicking it with my stash. Watching Netflix at the crib. Rubbing on your whole ass. Stop playing, nigga. Want a war? Let's get it. Stop praying, nigga. Ain't spraying your kids or them bitches. See, this what you asked for. Made me pick that mask up. See your sister blast her. I bet that wake your ass up. See, I'm gangsta as I wanna be. Ain't nobody touching me. Catch me out in public, and I never have security. Stop telling him and her what you gon' do to me. Been all across the world and ain't a nigga took my jewelry. Sent so many shots, police don't know who to get it killed to. Damn, I can't stand you. Them hoes they been ran through. And coughing up their blood gon' make it hard to understand you. I been talking to the plug, he bragging about what I just ran through. Don't forget about these hands, don't make a nigga silly fan you. 10 shots to your lip gon' make it hard to understand you. Don't forget about these hands, automatic guy jab you. 10 shots to your body, had you feeling like I stabbed you.
Hey bro, come up out of here, bro. What the fuck going on? Come out of here, man. Let me get out of these niggas, bro. Hey, fuck these niggas. I don't want to get this shit. I don't want to get this shit, bro. I want these fools ass, bro. Every time I get in this motherfucker, I'm on the head. Every chance I get, you know, nigga. Can't do it up.
We should shoot a real video for that damn song. Anyway, pretty girls to the dance floor, ugly girls to the parking lot. Get lost, please.